Good morning.
Good morning to everyone. Thank you, Florina, for inviting us. So from time to time, we will we will ask for the help of the translator, because we wrote also in French. So we asked for a friend that is named Google Translator.
Translator is Emily. Let's.
Yeah. No.
We have two. We have the choice. Florentina and Emily are homeopaths, and they are translating very well. So we'll see how we can manage this.
Okay.
But you are going to share the screen, isn't it?
Yes, of course.
Great.
So we want to present a part of our work, and this is related especially to groups and teams, and we will try to explain our way of working.
Ok. On traduit, Émilie?
Donc, on voudrait vous présenter une partie de notre travail qui est surtout liée au groupe et au thème.
Okay, so as Roberto told us, we would like to present you our way of seeing homeopathy and how we are thinking during our case taking and how we are understanding homeopathy.
Donc, comme Roberto vous l'a dit, on voudrait vous présenter notre façon de penser en homéopathie, comment on prend le cas et comment on pense au cas.
So understanding the homeopathy through different languages.
Donc, on comprend l'homéopathie par des langages différents.
And you will understand later that why I'm emphasizing the different languages that we are hearing when we are doing the case taking.
Et vous allez comprendre un peu plus tard pourquoi je mets l'accent sur la notion de langages différents qu'on entend pendant la prise de cas.
So the topic is from homeopathy of symptoms to homeopathy of symptoms and themes.
Donc, le sujet d'aujourd'hui, c'est partir de l'homéopathie des symptômes à l'homéopathie des symptômes et des thèmes.
So homeopathy was always based on symptoms. So this is how we were educated to rely on symptoms, both in provings and in case taking. But for some years, we started to look at the symptomatology of the provers and the patients in a different and wider way, considering themes. So sometimes we were grouping remedies according to miasms or groups. So this is the vertical flow chart that how modern homeopathy evolved. So we started from the idea of creating miasms, and then from miasms we arrived to remedy. Then we created families, and we understood that also from family we can arrive the remedy. And then in the modern ages we created kingdoms, and in kingdoms we created families, and through this kingdom and family we arrived to the level of remedy. So this is how we are thinking in homeopathy, a little bit wider, and we place the vertical point of view into a horizontal flow chart. So ECAP GPS is the result of many years of working hours and brainstormings together, sharing ideas, or just thinking together how to make homeopathy easier how to analyze and understanding the patient's words and phrases during our case taking. So during the case taking, we hear the patient using her own language, explaining her history and her problems. But it's important to understand that this language and make a selection between the patient's word. So we can perceive different levels of languages, and these different levels are mostly related to the remedy. Me and Roberto, we do believe that the patient is speaking using different levels of language, sometimes more specific and sometimes less specific. But when we understand the characteristics of these different levels, we immediately find ourselves in a structured system that guides us easily. So sometimes the patient is using non-specific languages. And these languages, these words are coming from the environment or the kingdom or the attitude or the period where the remedy is. And the other moments are more specific languages we are here. And this language is coming from the group or the part, so-called subgroup. And sometimes we are hearing some words from the substance level. For every level, we created 8 essentials, 8 characteristics that they are not keynotes, but essentially themes to define the particular ensemble. So for every ensemble I'm going to show, we have 8 essentials describing them. We should try to understand which language the patient is using. This is our method, the horizontal flow chart, the ECAP GPS. So you see all together the environment, kingdom, attitude, period, and the more specific level, the group, part, a subgroup, and substance. We have 5 environments: water, air, ground, underground, and universe. We have 7 kingdoms: animals, plants, minerals, fungi, nosodes, sarcodes, and imponderables. We have 4 attitudes. We have prey, amphoteric remedies, predator, and parasites. Amphoteric means that sometimes these patients or these remedies can act as a prey or a predator, but usually they are in a balance. So not very overwhelmed by the prey attitude and not really overwhelmed by the predator. So it's a kind of balance that how to switch in different situations and how to act in these different situations. The 8 level of periods, we understood it from the periodic table. So we have remedies that belongs to the hydrogen period, carbon period, silica period, ferrum period, argentum period, gold, lanthanides, and actinides. And these periods, it's very important to underline that we do not place just the mineral remedies in these 8 levels, 8 periods, but also we are listing our remedies coming from different kingdoms, also from animals, also from plants or fungi, nosodes, and so on.
Just a moment, we can translate this.
Sorry.
Donc, elle disait que quand elle parle de la période, enfin, ce sont les différentes lignes, les différentes étapes du tableau périodique qui sont ici signifiées effectivement par des éléments minéraux. Dans ces étapes, elle inclut également des remèdes qui viennent d'autres règnes. Donc, ça peut être également des plantes ou des animaux qui rentrent dans les mêmes 8 étapes ou lignes du tableau périodique.
Yeah, because
sometimes, for example, we are seeing a plant quality and the lanthanide quality. So something that is similar to a plant and something that is similar to lanthanide. So we are trying to understand which kind of groups or which kind of plants has the lanthanide attitude.
Parce qu'il arrive qu'on voit des plantes, des végétaux donc, qui présentent des qualités de lanthanide, des qualités des actinides. Et ainsi, nous essayons de comprendre quels groupes de plantes, par exemple, vont présenter des qualités lanthanides et essayer de faire une corrélation.
Or this can be also for animals, of course. So if we have a patient that seems like an animal with lanthanide quality, we are thinking, for example, to birds of prey.
Donc, par exemple, on peut avoir des fois des animaux, donc un animal qui va présenter, ou des oiseaux qui présentent des qualités lanthanides, et nous pensons dans ce cas à des oiseaux de proie.
So we arrive to the more specific language, and the first part of the GPS level is the group, the G. So just for example, to understand that how we see groups in homeopathy, so we have Muriaticums as a group, we have reptiles as a group, we have water invertebrates as a group, we have birds as a group, and also we have aquatic plants as a group.
Donc, dans leur grille de la lettre G qui désigne le groupe, donc elle insiste sur le fait qu'il faut bien identifier les différents groupes en homéopathie. Et là, elle donne quelques exemples, les muriaticums, les reptiles, les oiseaux, les invertébrés aquatiques et les plantes aquatiques.
And in between these groups, we have subgroups, parts. So you see the Muriaticums, reptiles, aquatic invertebrates, birds, and aquatic plants. So for example, in Muriaticums, we can have 2 subgroups, just for example, but also we have even more. So in Muriaticums, we have the subgroup of barium. Also in Muriaticum, we have the subgroup of calcium. Or in reptiles, we have a subgroup of snakes, and we have the subgroup of lizards. In aquatic invertebrates, we have the subgroup of cnidarians and mollusc bivalves. In birds, we have the birds of prey. And in aquatic plants, for example, we have the river banks remedy subgroups.
Yeah, this is just an example. For example, in aquatic plants, we created 5 subgroups. In water invertebrates, we created 7 subgroups.
Donc, il vous montre ici que les groupes eux-mêmes ont par la suite des sous-groupes. Et ils peuvent avoir, donc à l'écran, il y a que deux exemples. Par exemple, les muriaticums, on peut retrouver le sous-groupe des barium comme des bêta, comme les sous-groupes de calcium. Dans les reptiles, on va avoir les serpents et les lézards. Dans les animaux aquatiques invertébrés, nous pouvons avoir les cnidariens et les mollusques bivalves. Mais il faut savoir que, donc il a parlé en fait des plantes aquatiques. Et dans les plantes aquatiques, il a dit qu'il y en avait, si j'ai bien retenu, 5 sous-groupes. Dans les invertébrés aquatiques, il y a 7 sous-groupes.
This is because, for example, we can see some themes that are general themes, for example, of reptiles. But then we can have some more specific themes that can be themes related to snakes or to lizards or to turtles or to crocodiles. I mean, different kind of reptiles. And then we will see a more specific language that is related to the most specific remedy.
Donc, la façon dont nous approchons les choses, c'est que par exemple, on voit des thèmes généraux, des thèmes généraux qui s'appliquent aux reptiles. Et dans les reptiles, on a des sous-groupes et on voit des thèmes spécifiques qui s'appliquent à ces sous-groupes, des thèmes qui vont être spécifiques pour les serpents, des thèmes spécifiques pour les lézards ou les tortues ou les crocodiles. Et puis, dans le sous-groupe, on va identifier qu'est-ce qui est spécifique à chacun des remèdes.
Ben, we don't speak French, sorry, but just a message arrived. And for what I understood, it was related to the fact that bariums are not a subgroup of Muriaticum. I mean, may you translate this?
So he says, I understand the subgroups of animals and plants, but William is asking how come that barium is a subgroup of muriaticums?
Yeah, because we planned that we place the anions as groups and cations as subgroups.
Donc la réponse à William, comment ça se fait que les bariums, on les considère un sous-groupe des muriaticums? C'est parce que nous avons considéré les... so anions as groups, you said, right?
Yeah.
Nous avons considéré les anions comme des groupes et les cations comme... non, oui,
Yeah.
les cations comme des subgroupes.
So we give just a simple example. So if we are seeing some themes related in general to Muriaticums, then we have to choose which kind of Muriaticum, so which cation. So we have the idea that is Muriaticum, and then which kind of subgroup, so which kind of cation. Could be a barium, could be a calcium, could be a natrium, could be a zincum, an argentum, and so on. So for this reason, we place these anions as group and cations as subgroup.
Donc, c'est pour ça que nous considérons les anions comme groupe. Par exemple, si nous identifions des thèmes des muriaticums et après, on va essayer d'identifier quels cations, donc quels sous-groupes on doit prendre en compte. Ça peut être le barium, le natrium, le argentum et ainsi de suite.
So from group and subgroups, we arrive to the substance that, as Roberto explained, in Muriaticums, the barium, calcium, but for example, the different substances in different groups and subgroups from Muriaticums, barium, Muriaticums, or bariums, we arrive to barium carbonicums. In calciums, we arrive the calcium muriaticum. In snakes, we arrive, for example, the Crotalus cascavella. In lizards, we arrive to the remedy, for example, Lacerta agilis. In cnidarians, we can find our remedy, medusa. In mollusk bivalves, our remedy, for example, Venus mercenaria. In birds, we have the remedy, for example, the falco peregrinus. And in riverbirds, our beautiful remedy, the Salix fragilis.
Of course, this is just an example. Yeah. You can have many remedies in every subgroup.
Donc, comme vous voyez, on arrive à la substance. Donc, une fois qu'on a défini le groupe, le sous-groupe, on arrive à la substance, c'est-à-dire le remède en question dont on parle. Et ils ont donné des exemples dans chaque sous-groupe. On retrouve le remède exact qu'on cherche.
Okay, so we are going to give you an example with a case. It's a case of a man, 32 years old, that came for different pathologies, hypothyroidism, sciatica, and trigeminal neuralgia. So the patient is a 32-year-old man, but I have the feeling that I'm looking at a 16-year-old boy with minimal facial hair. He's clearly overweight and he has a confident attitude. I asked about development time and it was normal. Then we start to speak about the pathologies. So he has always been overweight, and at the age of 10, he had a diagnosis of hypothyroidism. He has been on medication from the moment of diagnosis, and at the time of consultation, he was taking 50 micrograms of levothyroxine. The discovery of hypothyroidism is made during an hospitalization. He had been suffering from pain in his right humerus for some time, and he was diagnosed with an osteoid osteoma that was surgically removed. At the moment of the consultation, the main problem is disabling right trigeminal neuralgia that has been present for almost 1 year. So I asked to describe the pain, and he described the pain as a lancinating pain. He's unable to express any modality, but he associates this neuralgia with an onset of a sensation of sweetish saliva that appears quite often. And this sweetish salivation causes him a sense of disgust, but he says that disgust is something that he has always suffered from. He's easily feeling disgusted. Then he told that for some years now, he has also suffered from recurrent episodes of right sciatica. And he was also complaining of frequent night sweats. And then he told also, I cannot stand noises. So this was more or less the information that I got from the physical point of view. And so I asked, okay, tell me about your character. And he started telling, I was always irritable. They told my parents I was a difficult child. I already had behavioral problems in the kindergarten. They thought I was an aggressive child because I often beat others. My results at school were never so brilliant. Teachers spoke about dyslexia and dyscalculia. Although I did not like being with others. I was never shy. In fact, I often undressed in the kindergarten. And he said, that's probably related to my relationship with sex. And so I asked, okay, let's talk about sex. And immediately he told me, I have masturbated a lot in my life, even as a child. And then he said, I know I have to tell the homeopath everything. And so he told, I'm not ashamed to say that I spend a lot of time looking at porn sites. And he started also to speak about his sexual dreams. Then I asked about fears. And he said, maybe it's related to disgust, but I'm afraid of infection and contamination. So I asked something else on the mental level. And he said, I often feel a bit confused. It's like my head is in the clouds. And then my memory, I often forget things. When I ask a question that I'm often asked to the patient, what would you do with Aladdin's lamp? Tell me 3 desires. And these are the desires. So money, sex, power. Okay, let's have a look to the symptoms from the repertory, because what we are doing during consultation is always doing a repertorization. So the patient is speaking and we are taking rubrics. I don't know if you want to translate this phrase, please.
Si, parce qu'on prend les symptômes du répertoire et vous voyez un peu à l'écran tous les gens qui ont contribué en fait à Radar Opus.
Okay, so let's have a look to the symptoms that we took. So cancerous affections, cancerous affection of bones, tumors, osteoma, hypothyroidism, obesity. We are taking a lot of rubrics, and sometimes we are prescribing a remedy with 0 symptoms in the repertory. So the repertorization is not something that we are obliged to follow.
Donc, voici ici quelques rubriques répertoriales, mais il faut prendre en compte que des fois, nous devons prendre en compte des symptômes qui n'ont pas de traduction répertoriale. Donc, le répertoire n'est pas quelque chose que nous sommes censés à suivre à 100%.
So the trigeminal neuralgia, so the face pain that he described as lancinating, face pain nerves, trigeminal neuralgia, and this sweet saliva and the sweetish taste.
Donc, vous avez les rubriques qui étaient traduites.
Then the sciatic pain, so extremities pain lower the sciatic nerve, the perspiration at night, perspiration during sleep, and from the mental point of view, this shameless, the disposition to masturbation. We took also the rubric in female, sexual desire premature, but it's just, I mean, we don't care if it's female and the patient is male. So this is a rubric that is giving us remedies that has this tendency. It's not important if it's male or female.
Donc, en plus de ce qui est affiché, il mentionne que nous avons pris également la rubrique sexualité, désir précoce qui se trouve dans le chapitre femmes, mais ce n'est pas important que ça soit femme ou homme. Ce qui est important ici, c'est le désir sexuel précoce.
When the sexual desire violent, the sexual dreams, easily anger, behavior problems in children, biting, egotism, aversion to company, disgust, fear of infection, sensitive to noise. Okay, so this was the repertorization. And if you just look at the repertorization like this, you see phosphorus, nux vomica, platina, sulfur, mercury, arsenicum, lycopodium. I mean, we are always seeing the same polycrest in every repertorization.
Donc, vous voyez ici la répertorisation suite aux rubriques choisies. Vous voyez qu'en premier, nous avons phosphorus, nux vomica, platina, sulfure, mercurius. Ce sont les remèdes qui sortent en premier dans toute répertorisation.
But in his way of speaking, what I thought, I heard the language of amphibians.
Donc, mais dans son cas-ci, qu'est-ce que j'ai entendu? J'ai entendu le langage des amphibiens.
And I said, okay, but if he's an amphibian, which remedy can I think of?
Et je me suis dit, bah, si c'est un amphibien, quel remède, à quel remède je devrais penser?
And so checking the repertorization, I saw that in position number 8, I see an amphibian that is buffo.
Et en regardant la répertorisation, j'ai vu qu'à la position, à la 8e place, il y a un amphibien et c'est Buffo.
And you see that there's many rubrics that are highlighted where you can find buffo.
Et vous voyez ici les rubriques qui sont identifiées en bleu où on retrouve le remède Buffo.
So for this reason, I prescribe buffo.
C'est pour cette raison que j'ai prescrit Buffo.
We are using usually Korsakoff potencies, repeating remedies in drops. So we started with 10 giving 5 drops twice a day.
Nous utilisons souvent des corsacoviennes et on répète. Donc, j'ai donné du XMK, 5 gouttes, 2 fois par jour.
So, despite the use of 5 different potencies, the improvements were minimal. But since the sciatica problems has not recurred, the patient was to go on with homeopathy, and he told me, maybe we can change the remedy. I said, of course, but which remedy? Which remedy do I have to give? So for us, it's very important to correct our mistake in the right way. So, yeah.
Donc, comme vous avez compris, donc j'ai donné plusieurs dilutions de Buffo, mais il n'y a pas eu vraiment d'amélioration énorme. Par contre, le patient, il a voulu continuer avec l'homéopathie car il n'y avait plus de sciatique. Donc, je dis, OK, bon, je vous donne de l'homéopathie, mais quel remède? Pour nous, c'est important de pouvoir corriger notre erreur.
So, if we prescribe an amphibian, we have to take care of this first prescription and do a differential diagnosis with other amphibians or with groups that are more or less similar.
Donc, si nous avons commencé à prescrire un amphibien, nous devons par la suite essayer de faire un diagnostic différentiel soit avec d'autres amphibiens, soit avec d'autres groupes de remèdes qui se ressemblent plus ou moins.
So let's try to follow our way of thinking now.
Donc maintenant, essayez de suivre notre façon de penser.
So I thought, and we got an idea for a new remedy. And in this case, and I will explain why later, the prescription was the 30C, 5 drops twice a day.
Donc, j'ai réfléchi, j'ai eu un nouveau remède que j'ai donné en 30 CH, 100 gouttes 2 fois par jour.
So after 3 days, the patient had an attack of trigeminal neuralgia, which resolves in half a day by taking the remedy 3 times every 2 minutes and then every 30 minutes. And from that moment, the trigeminal neuralgia has not occurred. Then he reported less anger, but he told no change on sexual compulsion. So we went to 200, 3 drops twice a day. After 1 month, no change. So we switched to 5 drops twice a day, asking to increase 1 drop every 2 weeks. After 2 months, the patient reports greater control of sexual urges. So he was taking 10 drops. We went on with 10 drops twice a day. Then the patient starts losing weight and the TSH drops from 5.2 to 2.4. So the endocrinologist reduced the levothyroxine to 25 micrograms, and after 1 year, he stopped completely the drug. The patient lost 22 kilos. After 6 months, all symptoms have disappeared except night sweating, which has improved by 50%. So it was better, but not completely gone. So let's try to analyze the case. So why we thought of amphibians? So we will show now the 8 essentials that we wrote about amphibians. So what we think is really important in amphibians. So the self is divided, damaged, and completely out of awareness. Power, money, and above all, sex. He wants to be the boss, creating a prominent position for himself and being served by others. And this we can see especially in the first phase. He wants to isolate himself to stay away from the side of social judgment. And this is something coming in the second phase. He feels ashamed and abandoned with a tendency to self-loathing. Increased sweating, especially during the night. Affinity for the brain and nervous system. We know that these are good remedies for epilepsy, mental development disorders. Tumors, pathologies, and skin disorders like boils, carbuncles, deep ulcerations. Then I want to introduce you a phenomenon that is named neotenia. So neotenia is the phenomenon whereby an organism reaches sexual maturity while retaining larval or juvenile characters as a result of environment factors. And in this case, changing these conditions can lead to the metamorphosis. Or it can be also related to genetic factors. In zoology, the condition peculiar to a character that occurs permanently in the larval of juvenile phase. For example, in humans, the lack of dense hair on the body, which is characteristic of all adult primates. So we are always thinking in terms of hierarchy. So, and this neoteny makes me think of a young body in an adult mind with a developed sexuality from a young age. So the patient has had an osteoid osteoma, and I know that amphibians have an enormous regenerative capacity and can be remedies for tumor diseases. So I need a remedy for hypothyroidism. I need a remedy for trigeminal neuralgia and sciatica, so for neurological conditions. I need a remedy for disgust and easy irritability. So thinking, and let's read some part of a proving that was made in Germany. And in this proving, it's written, neuralgic pain in the face on the right trigeminal nerve. Sciatica painful. In the materia medica, we can discern the picture of a teenager experiencing sexual desires and taboos. Irritability, impatience, aggression, impulsiveness. Disgust, feels contaminated. Do not wish to socialize. Sexual dreams. Sweat at night. Neuralgic pain in right trigeminal nerve. Sciatica. Sweet tasting saliva. So it really seems the patient. So we have always to think that we can prescribe just what we know. If we don't know something, we cannot prescribe. So the prescription. Before telling the remedy, I will read you the 8 essentials that we wrote for this remedy. Body of a child with thoughts and sexual development of an adult. Power, money, and especially sex. Sensation of dirtiness all around with disgust and feeling of contamination. Sensitiveness to and irritated by noises. Increased perspiration, especially at night, on forehead and upper part of the body. Neuralgic pain, sciatica and trigeminal neuralgia. Tumors and cancer, and hypothyroidism. So, and this remedy is Ambystoma mexicanum, the so-called axolot. So let's have a look to this animal. So let's go back to neotenia. So neotenia is an amazing phenomenon that affects these species as well as other salamanders. Axolot is the neotenic form of Ambystoma mexicanum. Ambystoma mexicanum is able to become sexually mature and thus be able to reproduce while retaining gills, an aquatic mode of life, and other larval characteristics. The individuals that do not metamorphose are called axolotl. So this animal therefore reaches sexual maturity and is able to reproduce while remaining a tadpole, so the infant form. Circumstance that could lead to the inclusion of this amphibian in the rubrics of sexual activity in children. For similar reasons, this remedy may perhaps prove useful in early puberty. Sometimes an axolotl can metamorphose spontaneously, so it's 1 on 10,000 cases. But metamorphosis can be induced by administering thyroid hormones. So, and this can be very interesting in the case of this patient. In fact, the Ambistoma mexicanum, the pituitary gland, does not release any thyrotropin. So no T3 synthesis can be activated in the thyroid, making the metamorphosis impossible. If a young axolotl is taken and reared in water by adding thyroxine, the gills regress and the skin changes significantly. In short, the complete metamorphosis occurs. This means that it's the thyroid hormones that enable metamorphosis in amphibians. This fact could be used homeopathically in cases of hypothyroidism, because axolotl is a constitutional hypothyroid. Then another interesting part of amphibians is related to tissue regeneration, and especially is a surprising property of axolotl. So they are able to regenerate their own tissues. This animal is able to heal from any mutilation it can survive. Limbs, eyes, tail, and even internal organs can be regenerated. So if you think to tumors, so starfish, the Asterias rubens, some salamanders, some fish, for example, zebrafish, have a strong tissue regenerating abilities. They could be indicated in tumors because of the analogy between the strong replicative drive of cancer cells and the regenerating tissue drive of these animals. Asterias rubens has long been described in homeopathic literature as a remedy for breast cancer. Then, despite its harmless and defenseless appearance, this animal can develop the most brutal behavior found in nature, that is cannibalism. An axolotl that becomes cannibalistic grows faster and can metamorphose more easily. In a way, the price for growing is cannibalism. From the homeopathic point of view, perhaps axolotl could be useful in children with difficulties in managing their aggressive impulses, as children with a tendency to bite. So, we have 0 symptoms on synthesis adonis for this remedy. We included this remedy in reptiles and amphibians in reptiles, also if the amphibians are not reptiles, but from the homeopathic point of view are reptiles, so are very similar to reptiles. So this is the schema of the ECAP GPS for Ambystoma mexicanum. So we have water, animal is a predator. Is a predator does not mean that this animal is a predator. From the homeopathic point of view, people that need this remedy are predator. So, for example, related to the aggression, but you will see later.
Can you translate?
Yeah, please.
Il n'y a pas de micro, Florentina.
Pardon. Donc, nous avons ce système qui est EKAPGS et donc il y a quelque chose qui est attribué à chacune des étapes pour définir le remède. Et là, vous voyez que c'est prédateur, même si dans la nature, c'est pas vraiment un prédateur stricto sensu. D'un point de vue homéopathique, il peut être considéré comme un prédateur par son agressivité, par exemple. Et on va expliquer aussi un peu plus loin.
So this is the then the group reptiles, the subgroups amphibians, and the remedy. So don't worry about these numbers. These numbers for us are just useful to create a program.
Donc, les numéros que vous voyez à l'écran, pour nous, sont utiles à créer, à les utiliser dans un programme.
So let's try to analyze the different symptoms according with the ECAP GPS.
Donc, on va voir les symptômes différents qu'on peut, on peut encadrer dans le grille de lettres qu'il a mentionné.
So this means that now I will divide the repertoire rubrics into groups. So I will show which are the symptoms for the environment, the symptom for the kingdom, and so on.
Donc, ça veut dire que maintenant, je vais essayer de diviser les symptômes répertoriels dans les différents groupes. Donc, je vais vous montrer quels symptômes, quelles rubriques je vais mettre avec le groupe environnement, par exemple, et ainsi de suite.
So, for example, dyslexia, dyscalculia, confusion, and problems with memory for us are themes related to, especially to water.
Donc, par exemple, pour nous, la dyslexie, dyscalculie et la confusion, la mémoire, ce sont des thèmes qui sont reliés à l'eau dans l'environnement.
So what does it mean? That if we have a patient with this kind of problems, we are thinking especially to the water environment.
Qu'est-ce que ça veut dire? C'est que si nous avons un patient qui présente ce type de pathologie, de problème, nous pensons d'abord à un environnement de type eau, aquatique.
So I underline especially to this environment. This does not mean just to this environment.
Donc, je mets l'accent sur le fait qu'on va penser surtout à un environnement aquatique. Ça ne veut pas dire que c'est toujours l'environnement aquatique.
So, for example, when we are dealing with a patient with dementia, the first environment we are thinking of is water.
Par exemple, quand nous pensons à un patient qui a la démence, le premier environnement pour nous, ça sera l'environnement aquatique.
So Viktoria was the first one that wrote a book about fish. So she has a large experience on fish and the relationship between fish and dementia.
Viktoria, donc ici présente, a été la première à avoir écrit un livre en homéopathie sur les poissons, donc la première aussi à avoir mis en relation les remèdes aquatiques avec la démence.
Then let's go on and let's see the kingdom. So, and
Continue avec le règne.
symptoms for the kingdom, themes for the kingdom are money, sex, and power.
Donc, les symptômes qui vont définir le règne, ce sont l'argent, le sexe, le pouvoir.
So these are themes for the animal kingdom.
Et qui nous amènent au règne animal.
Then let's see the attitude, and these are themes for predator, confidence, irritability and aggressiveness, and again, money, sex, and power are themes for predators.
Donc maintenant, on définit l'attitude et les thèmes comme la confiance, l'irritabilité, l'agressivité, l'argent, le sexe, le pouvoir nous amènent aux prédateurs.
Then the period. So the period for us is the period 6, so the gold series, and the osteoid, osteoma, and also money, sex, and power are related to the period number 6.
Donc la période, l'étape, la ligne, nous avons ici donc, le sperme ostéoïde ainsi que l'argent, le sexe, le pouvoir, et ceci nous amène à la ligne 6 donc, du tableau périodique.
Then group. So younger appearance, sex and excessive masturbation, we can relate to reptiles.
Dans le groupe avec l'apparence plus jaune, le sexe et la masturbation excessive nous amènent aux reptiles.
Then we go to the subgroup, so the amphibians, and osteoid, osteoma, night perspiration, sex and excessive masturbation, money, sex, and power, we also relate to amphibians.
Et si maintenant on essaye de se mettre dans quelle partie, on va trouver donc avec l'ostome ostéoïde, la transpiration nocturne excessive, le sexe et la masturbation excessive, l'argent, le sexe, les pouvoirs, on arrive sur les amphibiens.
And then when the patient spoke the language of the substance, so the language of the remedy, so the younger appearance, all these things are related to the remedy. Younger appearance, hypothyroidism, osteoid, osteoma, trigeminal neuralgia, sweet saliva, disgust, right sciatica, night perspiration, sensitive to noises, irritability and aggressiveness, sex and excessive masturbation, infection and contamination, money, sex, power, all these things are related to the remedy. So, as I was telling before, for us it's important start from the mistake to correct the mistake. So, these are the 8 essentials that we wrote about water. So, absent-minded, as if not living on the earth, confusion in space and time, lightness feeling, dreamlike sensation, alone, detached, seems indifferent to others, mistakes in writing, reading, speaking, and spelling, forgetfulness, mostly living in the past, nature, water, waves, flying, floating. Some feelings for the water can be heaviness, dullness, vertigo, nausea, constriction, dryness, itching. And we have to think very often to water remedies for female disorders like amenorrhea, infertility, miscarriage, and sexual themes in both women and men. So sexual theme does not mean sexual desire, means something related to sex.
Donc, à la fin de l'explication, c'était marqué sexualité. Donc, je tiens à préciser, sexualité, ce n'est pas désir sexuel, mais des thèmes sexuels, de sexualité chez les femmes ou chez les hommes.
So these are the 8 essentials that we wrote about animals. So competition, domination, territory, and hierarchy, aggression and conflict, danger and threat, survival, mors tua vita mea, so the theme of victim versus aggressor, I versus myself, so it can be I hate myself, I don't accept myself, I versus other, like he's better than me, I will jump at him, I will kill him. Interaction and reaction to the environment, so an animal control that is related to other person. I mean, related to control, that is a theme that is a very general theme. We always divide the control in the mineral kingdom, plant kingdom, and animal kingdom.
Donc, quand nous avons un thème général, très général, comme le contrôle, on va essayer de diviser, de départager en fait ce thème entre les différents règnes, le règne animal, le règne des plantes et le règne des minéraux.
So for the mineral kingdom, the patient with a mineral remedy has no problem with control because control is part of his DNA. So it's a completely natural acting in a controlled way.
Donc, pour quelqu'un qui a besoin d'un remède minéral, il n'a pas un problème avec le contrôle, car le contrôle fait partie de son ADN. Il est tout à fait naturel pour lui d'être en contrôle.
In general, in the plant kingdom, the control is a reaction related to the fact that emotions are overwhelming the patient, and so they have to control emotions.
Dans le règne végétal, le contrôle, habituellement, c'est une réaction et c'est lié aux émotions qui débordent. Donc, c'est une réaction aux émotions débordantes.
And the animal kingdom, the control is related to someone else, not to something else, so to other persons.
Et dans le règne animal, le contrôle est lié à quelqu'un d'autre et pas à quelque chose d'autre.
So other themes for the animal kingdom are the group feeling and the seduction.
Donc, d'autres thèmes, c'était la sensation d'appartenance au groupe et la séduction pour les animaux.
Then the 8 essentials that we wrote about the predator attitude is searching for adrenaline in everything I do. Okay, these teams, we paid some millions of euros to Queens. So we are the champions, my friend, and we'll keep on fighting till the end. Competition, power, self-assertion, and domination. Self-confidence and strong will. You cannot criticize me because I'm perfect as I am. Aggressiveness against the criticism, but always ready to criticize. Sudden and intense anger and connection to death. So when you are thinking to a predator, don't think just to an animal, because there's many remedies that are predator and are not animals.
Donc, si vous pensez à un prédateur, ne pensez pas que c'est juste dans le règne animal. Il y a beaucoup de remèdes qui sont des prédateurs tels qu'ils ont été expliqués ici avec les thèmes qui ne sont pas des animaux.
So, for example, almost all the Graminaceae has a predator tendency.
The graminaceae?
Yeah.
Donc, par exemple, les graminées ont presque tous des tendances de prédateurs.
So, for example, Triticum vulgare has this tendency, absolutely this tendency to be a predator.
Par exemple, Triticum vulgare, c'est a une tendance absolue d'être un prédateur.
Then we have the period 6. So, and for the period 6, we wrote these 8 essentials.
Donc, nous sommes à la période 6, donc à la ligne 6 du tableau périodique, et nous avons ces essentiels, ces notions essentielles.
So, for example, Triticum vulgare has, according to our experience, the attitude is predator and the period is 6.
Par exemple, Triticum vulgare, selon notre expérience, a cette tendance de prédateur et il se trouve sur la ligne de la période 6.
So, power and social status, leadership and command, responsibility, workaholic and industrious, withstanding with very high pressure, attack and defense, sexuality, eyes, bones, and cardiovascular complaints. Then the 8 essentials that we wrote about reptiles is camouflage, want to hide himself, 2 faces, misleading, misguiding, corruption, want to manipulate or feel manipulated or betrayed, violent and sudden attack, precocity but immaturity in adulthood, sexuality, provocative, violent, jealousy, seduction, sensitive to change of weather and temperature, acute sense in taste, smelling, touching, and syphilitic tendency. The amphibians we already saw, so I jumped. So these are the 8 essentials of Buffo. Okay, we are a little bit delayed. You can have the slides of the presentation, so you can read it without any problem. Okay, so this was the first case.
Ceci, c'était le premier cas.
I don't know if we can go to the second case or you want to ask something.
Donc, pour info, vous allez avoir les slides, donc la présentation. C'est pour ça qu'il est allé un peu vite sur les thèmes de Bufo-Rana. Est-ce que vous avez des questions précises pour ce cas ou on passe au deuxième cas?
Ok, on peut passer au deuxième cas. Ça nous ferait un tout petit peu retarder la pause, si vous êtes d'accord, mais c'est passionnant de continuer, je pense.
Let's go to the second case then.
Okay. So this is a case that we saw in October 2019. A young man, 21 years old, and he came for some allergic problems. So related to development, the only thing that it's important was related to the first tooth that was very delayed, 13 months. For the rest, everything was normal.
Donc, pour le développement, le seul vrai problème a été la première dent qui est sortie à 13 mois, le reste a été normal.
So these are his allergies.
Donc, toutes ces allergies.
So the symptoms. He has been suffering for about 2 years. Started with sneezing, nasal obstruction, watery and burning eyes. From March 2019, the symptoms worsened and lasted until the end of September. Of course, is worse when he's outside, and he told, in a park, after 10 minutes, I'm getting crazy. So when he told about his dry skin, nevertheless, he's 21 years old. Then he spoke about sport. He said, I always played sports and I live for sport, especially boxing and combat sports. But he dropped out after a retina problem. So after this kind of sport, what he went to do now is practicing weightlifting. Then we asked about his character and so on, and he started to speak about something that happened to him, about a black man that attacked a girl in the street. So I asked him to explain better, and he said, yes, I was walking, and at a certain moment, a black man was attacking a girl, and so I didn't think 1 second. I jumped on this black man, and I started to hit this black man.
On peut traduire?
Donc, en fait, il a expliqué que il y avait à un moment, donc il commence à raconter en fait qu'un homme noir attaque une jeune fille dans la rue et que lui, il ne pense pas du tout, il saute tout de suite et il il saute sur le dos de cet homme et il l'attaque.
Then you have to understand that in France, for sure, you have more habits to live with black people. Is a little bit different in Italy. So black people are not so integrated like in France. So this man was seeing this black man as someone that was attacking the girl. So he was doing something against the girl. And also, I think that is quite racist. So there was also this shade related to being a black man.
Donc, il faut comprendre un peu le contexte. En France, vous avez l'habitude de cohabiter avec les personnes de couleur. En Italie, c'est bien moins le cas. Et en plus, donc, il avait vu cet homme noir comme quelqu'un qui attaque. Donc, il est allé comme dans ce sens-là. Mais aussi, je le soupçonne qu'il est bien raciste.
And so I asked him to explain it better, and he told the world is full of danger. And he started to speak about how to defend himself and how you are alone in the world.
Et donc, en lui demandant en fait de m'expliquer un peu plus ce qui se passe, il me dit que le monde est plein de dangers et il commence à m'expliquer comment on est tout seul dans ce monde et comment on doit se défendre dans ce monde.
So you understand that what he was doing in his life, I mean, box, combat sport, this kind of attitude, it's not difficult to think that you have to deal with a remedy that has a predator attitude.
Donc, vous voyez bien que si on regarde ce qu'il fait dans sa vie, il fait de la boxe, il fait du sport de combat, il a cette attitude très agressive et combative, c'est pas difficile de le mettre dans la catégorie des prédateurs.
Then he spoke about angriness, aggressiveness, violence, but the sensation was a kind of heavy armor outside with an inner fragility. So, for example, also his appearance is quite feminine appearance. So you understand that there is a fragility, there is a kind of sweet attitude also, but outside the armor is really very heavy.
Donc, vous avez dans ce cas toute cette colère, agressivité et violence qui est comme une armure très lourde à l'extérieur. Par contre, à l'intérieur, il y a une grande fragilité et même dans son apparence, il a une apparence très féminine finalement.
Then at a certain moment he asked, may I take out my pullover? And I said, okay, it's not a problem. And he was there with a shirt. And when he was wearing the shirt, I saw a very big tattoo on his heart. And the tattoo was a graveyard.
Donc, cet homme à maman me dit dans la consultation, est-ce que ça vous dérange si j'enlève mon pull? Il dit oui, bien sûr. Donc, il enlève son pull, il porte un t-shirt et je remarque sur son bras un énorme tatouage, un tatouage qui représente un cimetière.
So a cemetery is a connection to death.
Donc, le cimetière, c'est bien sûr la relation avec la mort.
We have seen before that in the predator attitude, one of the 8 essentials is connection to death.
On avait déjà pu voir dans les 8 notions essentielles des prédateurs, c'est la connexion ou la liaison avec la mort.
So this tattoo could be a confirmation of a predator attitude.
Donc, ce tatouage peut être une confirmation supplémentaire de l'attitude prédateur.
But I asked, what does it mean? Why a young boy is having a big tattoo related to graveyard?
Mais je lui ai demandé quelle est la signification, comment ça se fait qu'un jeune homme a un grand tatouage qui est lié à un cimetière.
And he told, I dedicated this tattoo to my grandparents.
Et il me dit, j'ai dédié ce tatouage à mes grands-parents.
So what we are searching in homeopathy, strange, rare, and peculiar symptoms.
Qu'est-ce qu'on recherche dans l'homéopathie? Les symptômes qui sont rares, bizarres, inusités.
And sometimes we are taking rubrics like desire chocolate.
Et parfois, nous prenons des rubriques comme désir de chocolat.
So desire chocolate is not a rare, strange, and peculiar symptom, especially in France.
Donc, le désir de chocolat, bien sûr, n'est pas un symptôme rare, bizarre et curieux, surtout en France.
I don't know, perhaps it's strange in South Africa, not in Italy, not in France, not in Hungary.
C'est peut-être un symptôme rare et bizarre en Afrique du Sud, mais pas en Italie, pas en France.
But a graveyard as a tattoo dedicated to the grandparents, I've never seen.
Mais un cimetière sous la forme d'un tatouage qui est dédié à ses grands-parents, je n'ai jamais vu ça de ma vie.
So you know, which is our problem? Our problem is that sometimes we have a strange symptom, but we don't have in the repertory, we don't have in the materia medica, and so we discard that symptom because we are not able to read it.
Donc, vous voyez quel est notre problème. Parfois, on aperçoit un symptôme bizarre et curieux et rare, mais on le laisse de côté parce qu'on ne le trouve pas ni dans le répertoire, ni dans la matière médicale et nous ne savons pas l'utiliser.
So I asked him to explain better about this tattoo and about the connection with the grandparents.
Donc, je lui ai demandé de m'expliquer un peu plus sur ce tatouage et de me dire quelle est la connexion avec les grands-parents.
And from his explanation, it came out a theme that was the theme of nostalgia.
Et par son explication, je suis arrivée à une thématique qui était celle de la nostalgie.
Then he told me, I've always been a bit of a head in the clouds. In school, made a lot of mistakes in both writing and reading. Then I asked to tell me about recurrent dreams. And he gave me these dreams. Dreams of fights, dreams of killing, and dreams of violence. So now I will show you which are the dreams of the remedy that we prescribed. Dreams of animals, dreams about children, dreams about ocean, dreams about fighting, dreams about killing. Dreams is a predator. Dreams of violence. Then I asked him about the future. And when he's speaking, I could feel a kind of melancholy. He's quite pessimistic and indifferent, as if the future will not be so bright. And then the sensation that we had from this boy, we had the sensation that he has no doubts and tends to react all criticism as if he is perfect. So I'm perfect as I am. So we have already seen the themes about water. So these also mistakes in speaking, writing, this head in the cloud. Then we spoke about animals, the predator, and now the group. So the group is Vicky's responsibility because she is the master. So let's speak about your preferred group.
So my preferred group, so now you have an idea that which kind of group it can be, but let's see the 8 essentials to understand what is really characteristic and which kind of themes are describing the most this group.
Donc, on va parler du groupe maintenant et je laisse Viktoria en parler parce que c'est elle l'experte de ce groupe. Vous avez déjà un peu deviné de quoi il s'agit-il. Et on va démarrer par voir les 8 notions essentielles de ce groupe.
So the first theme that we wrote is solitude and isolation in a protected world. Detachment, like autism, dementia, Alzheimer's, and also we see this detachment, the detached sexuality. They are telling that my body is a protection and a prison as well. And here I would like to explain a little bit better that what does it mean protected world and what does it mean prison.
Donc, mon corps est à la fois une protection et une prison et j'aimerais vous expliquer un peu sur qu'est-ce que c'est une prison d'un côté, mais en même temps une protection.
So water animals, they have a key theme of protection. Also, this group has this key theme of protection.
Donc, les animaux aquatiques ont ce thème central qui est la protection, et c'est ce qu'on a vu aussi ici.
But every group in the aquatic environment has different solution how to have the protection or how to provide the protection.
Mais chacun des groupes des animaux aquatiques ou dans l'environnement aquatique présente des différents moyens ou des différentes solutions sur comment obtenir la protection ou comment offrir la protection.
Some group is asking help from other person. Some group is building a wall around. Some group is embodied himself in a cage.
Il y a certains groupes qui vont demander de l'aide à quelqu'un d'autre. Il y a un autre groupe qui va construire un mur autour de soi. Il y a d'autres groupes qui vont tout simplement s'emmurer dans une cage.
But this group that we are speaking about now, they are creating their own protected world that is completely different than the real life.
Mais ce groupe dont on parle maintenant, ils créent eux-mêmes leur environnement ou leur monde protecteur qui est complètement différent du monde réel.
So it's their own bubble world that is completely built up on their own preferences, their own desires, that they are feeling themselves free and protected.
Donc, c'est une sorte de bulle idéale qui est complètement différente de la réalité et où ils arrivent à construire leur propre désir, leur propre façon de protection.
So, and this phrase that my body is a protection and the prison as well, this means that the body is in the protected, own, created bubble world, that it's difficult to escape from it, especially if they are entering in their second phase of the pathology.
Donc, dans cette bulle protectrice qu'ils se construisent, donc il y a la protection, mais il y a aussi la notion de prison quand ils ont du mal à sortir de là. Ils sont comme emprisonnés. Et cette notion est d'autant plus exprimée vers la deuxième phase de l'avancement dans la pathologie.
Because if they cannot strive over this shifting, being in the real life and being in their own bubble world, this problem can occur, that they stay too much time in their own bubble world, that's creating for this unbalanced situation that they cannot escape. So sometimes this group has to come back to reality because this is the life.
Non, ceci arrive parce qu'ils ont tendance à rester trop longtemps dans cette bulle protectrice qui est imaginaire, qui n'est pas du tout réelle. Et donc, quand ça arrive trop longtemps, quand ils ne savent pas revenir de temps en temps à la réalité, il y a la pathologie qui se développe. Ce groupe a vraiment besoin qu'ils passent de leur monde imaginaire, de leur bulle protectrice, au monde réel.
So just imagine this problem related to dementia, that it's really a problem because they are stuck in their own prison, in their own bubble world.
Donc, imaginez-vous ce problème qui est celui de la démence, où les gens sont coincés, sont piégés dans leur monde imaginaire.
So let's go on the themes and you will understand now that which group we are speaking of.
On va continuer la présentation des thèmes et vous allez comprendre de quel groupe nous parlons.
So we see this theme that irritability against a world full of deadly dangers.
Donc, nous voyons ce thème de l'irritabilité contre un monde plein de dangers mortels.
And what Roberto showed in this case, and he highlighted this black man. In this case, it was a racism, but in general, black man, black hair woman, or people wearing black, it's appearing very often as a fear in this group, and especially two different subgroups. One subgroups we will speak about, and the other subgroups is like, now I will tell, like sharks or tuna fish. that they have this huge fear of black color.
Is the subgroup that we call on the move.
Donc, dans ce groupe, dans ce sous-groupe, en fait, vous allez voir, donc il y a deux sous-groupes ici. Et nous retrouvons dans tous les deux un thème qui est très important, celui du noir. Donc, dans le cas de Roberto, vous avez pu voir un homme noir, mais de manière générale, vous allez retrouver quelque chose, une femme aux cheveux très noirs, la peur du noir. Il y a le noir, il est omniprésent, et un de ces deux sous-groupes, c'est le groupe des requins ou du thon aussi. C'est le sous-groupe qu'on appelle, qui sont en train de bouger tout le temps. Et l'autre sous-groupe, c'est celui qui a le remède dont on va parler dans ce cas.
So in this case, this remedy acted, if it's not a racist remedy, for example, can act immediately, see a black color also on the skin or the hair or just the outfit with violence if the remedy has a predator attitude.
Would you mind repeating?
So if a remedy is coming from this subgroup or the on-the-move fish and has a predator attitude, seeing a black color on a skin, hair, or the clothes, immediately acting violence, immediately acting with a lot of anger.
Donc, dans ce sous-groupe, vous allez trouver donc l'attitude de prédateur et vous allez également voir quelque chose qui est noir. Ça peut être un vêtement noir, ça peut être une tache noire et ça vous amène tout de suite à penser, donc le noir vous amène à penser à la violence et, oui, à la violence et à la colère.
But if, for example, a remedy has a prey attitude, they will have a huge fear and anxiety and nervousness seeing black color.
D'accord, donc je précise un peu ce qu'on vient de dire. En fait, donc c'est ce remède qui est prédateur, s'il voit du noir, il va avoir donc de la violence et de la colère. Par contre, si vous avez un remède qui a plus l'attitude de proie, s'il voit du noir, ou quelque chose de noir, alors il aura plus de l'anxiété, de la peur.
Okay, let's go on this group. So the other theme is that I don't bother about your opinion because I'm perfect as I am. Aversion, responsibility. So this group will never be a very responsible person. We see on the physical level problem with infertility, and we see also hormonal problems. We see in discharge, so copious or suppressed discharges like leukorrhea, rhinorrhea, salivation, polyuria, diarrhea, and metrorrhagia. And this group is fish. And this is the 8 essentials in total.
Donc, on parle bien du groupe des poissons et vous avez à l'écran les 8 notions essentielles du groupe des poissons.
Okay. But we have to understand that which subgroups we will find our remedy in fish. So these subgroup characteristics are melancholy, feeling blue, and grumpy. There is no happiness at all in the life, just crime and danger. The future is dark. We don't know that what will happen, but maybe better than the present. So you see that they are very pessimistic for sure that the future is horrible, but the present is even more. So step away from the present and step in the future, also if it's a fearful and dangerous future. They want to live in the future rather than the past, because they have an experience that what happened in the past. But also in the past, it was happiness, but not their happiness. So you see this tattoo, that the happiness of the grandparents, but not his happiness. We see the thing that indifferent to others, he is just an observer in the world with full of danger. They feel unloved and also feel that he cannot love anyone. Unpleasant to others, no one can disturb him, but can act quickly with anger if sees injustice. I told you about pessimism. So we see that these subgroups in general, they have tendency for craving for alcohols and chocolate to find some temporary joy. And this subgroup is the bottom-dwelling fish. Yeah, here on the slides, it's a predator's bottom-dwelling, because in the book that I wrote, at the beginning, I listed fish, predators, and non-predators. So this was the group of predators bottom-dwelling. But then we started to work together. Then we understand better the water remedies, and we understood that being predator and being prey is the attitude. So from this idea, we opened up our knowledge and created the ECAP GPS and predators. Now you understood that it belongs to attitudes.
Donc, il faut donc elle a décrit tous les thèmes et puis les sous-groupes et elle est arrivée au sous-groupe des prédateurs habitant au fond de l'eau. Et elle dit, je tiens à vous préciser, quand j'ai écrit mon livre, effectivement, j'ai parlé des poissons qui habitaient au fond de l'eau ou qui habitaient un peu plus haut, mais on a compris aujourd'hui que être prédateur ou être proie, c'est une attitude. Et aujourd'hui, on classifie ou on a mis toutes ces thématiques pour arriver à définir bien les sous-groupes.
Okay. And the remedy that helped this boy, the essential. The first is angriness, aggressiveness, and violence, heavy armor outside with inner fragility. Finding the balance in feminine and masculine inner forces. Ambition and competition with desire to be the best. I'm the leader, I'm the boss. Searching for adrenaline in everything I do with hurriness. Depression, detachment, and cut-off sensation. There is a wall around which it is impossible to get through. We are all part of a melodrama. Nostalgia, time is a transformation. We see sleep disorders, and we see respiratory complaints and allergy on the physical level. And this remedy is the sturgeon. So the 8 essentials in total. And the homeopathic Latin name is Accipenser transmontanus. So you see the ECAP level. So this fish belongs to water, like environment, kingdom, animal kingdom. It has a predatory attitude. He has theme that coming from the period 3. We see this fish belongs to group of fish, subgroup of bottom-dwelling fish, and we arrive to the substance. What else do you want to?
Okay, we are sorry because we understand that present a very different way of working would need perhaps 2 days and not 1 hour. But we are very thankful to Florina that gave us this opportunity. And if you have any question, we will be happy to answer if we know the answer.
You can share the slide with your books, because I didn't mention them, so thinking that you have already at the end of the presentation.
Okay.
Donc, voici notre façon de travailler. Je suis tout à fait conscient que ça a été trop rapide pour une présentation d'1 heure. Ça a besoin d'au moins 2 jours pour être expliqué. Mais voilà, si vous avez des questions, n'hésitez pas.
So this is our website. Yeah, okay, but this is... So our website is homeopathy8.com, where you can find information about our seminars and webinars.
Donc, vous avez à l'écran notre site, c'est homéopathie8.com. Vous avez de l'information là-dessus sur nos webinaires, sur nos formations, sur nos livres.
So, and we are trying to involve you into our understanding of homeopathy, because we do believe that homeopathy can be easy, also if it's not easy, but we can try to make it easier.
Et nous essayons de vous impliquer tous dans notre travail de compréhension de remèdes, parce que nous sommes d'avis que l'homéopathie peut être simple, même si elle n'est pas simple.
So now we understand that all this information, amphibians, bottom-dwelling fish, fish, groups, subgroups, attitude, period, and so on, it can be confusing.
Donc, nous sommes tout à fait conscients que toute cette information très riche, très concentrée sur les groupes, les sous-groupes, les poissons qui habitent au fond de l'eau, avec l'attitude, avec la ligne du tableau périodique, ça peut prêter à la confusion.
But we are really trying to make it easier. So the idea is try to understand which language the patient is speaking. And sometimes we are able, for example, to recognize that is the water environment is, for example, the animal kingdom, and for example, the attitude, the predator attitude. And so in this way, we can think, okay, which is the water animal with predator attitude that I can prescribe?
Mais voilà, on voulait voilà, vous donner quelques clés, on va dire. Si vous avez un remède qui vous fait penser à l'environnement de l'eau, donc à un animal qui vit dans l'eau, avec une attitude de prédateur, quel animal, donc quel animal qui vit dans l'eau, je pourrais choisir pour mon patient?
So these are our books. So as I told you before, Fish in Homeopathy, Water World is the book of Viktoria. I wrote this book, Groups and Teams, where I listed 172 groups with 8 essentials for every group.
Donc, voici à l'écran nos livres. Comme je vous ai parlé au début, donc Waterworld, donc le monde aquatique, a été écrit par Viktoria. C'est le premier livre des poissons en homéopathie. Après, j'ai écrit moi-même le livre sur les groupes et les thèmes en homéopathie, où j'ai décrit 172 groupes de remèdes.
Then we wrote this book about matridonals in homeopathy.
Puis nous avons écrit ensemble ce groupe sur les remèdes matridonaux.
Okay, the 8 polycrest was just a test where we wrote 8 big remedies, the 8 essentials of 8 big remedies.
Le livre, les 8 polycrestes, ça a été juste un test. On a pris les 8 plus grands polycrestes et on a écrit leur thème, leur essentiel.
When we are, especially Viktoria, strongly involved in ADHD, so we wrote a book about ADHD and homeopathy.
Et puis, nous sommes très impliqués dans les troubles TADH, donc surtout Victoria. Donc, nous avons écrit ce livre qui a l'écran ADHD sur les troubles TADH chez les enfants.
When this ADHD Beyond the Label is a book that is not related to homeopathy, is just related to a different view of ADHD that we have.
Et puis, il y a le deuxième livre à l'écran. Il n'est pas relié à l'homéopathie. Ça s'appelle le TADH derrière l'étiquette ou au-delà de l'étiquette. C'est avoir une autre vision ou une autre approche de ces troubles de comportement TADH.
And very soon we will release ADHD in women, so not related to kids, but related to women.
Et bientôt, nous allons publier un livre de la TADH pour chez les femmes, donc pas chez les enfants, comme le premier livre à l'écran, mais chez les femmes.
But this is our beloved child, so that we are going to delivery.
Mais ceci, c'est vraiment notre enfant préféré que nous allons publier bientôt, également en d'autres langues.
So we are a little bit delayed because we are working also on the project of a program related to Wake Up GPS. But really, we are doing the last corrections. And so the book will be published in English and then Italian and then Spanish. And I don't know if Florentina, you want to translate in French, you are welcome.
Okay. Would be a pleasure. Donc, ce livre, Les animaux aquatiques en homéopathie, et on est un peu retardé car nous travaillons en même temps un programme informatique qui est relié aux acronymes dont on a parlé finalement toute cette matinée. Et donc, elle va être bientôt publiée en anglais, en espagnol, en italien, pourquoi pas aussi en français.
And in this book, you can read about 100 remedies that are water invertebrates, fish, aquatic reptiles, aquatic insects, aquatic birds, marine mammals and semi-aquatic mammals.
Et dans ce livre, vous allez avoir énormément de sous-groupes finalement, qui sont les poissons, les reptiles aquatiques, les insectes aquatiques, les oiseaux aquatiques, les mammifères marins et les mammifères semi-aquatiques.
Okay, this we showed Matridonals, 8 polycrest. Okay, if you want to follow us, we are quite social: Facebook, Instagram, LinkedIn, YouTube.
Bon, nous sommes très sociaux, donc vous pouvez nous suivre sur Facebook, LinkedIn, Instagram
YouTube.
et YouTube.
There is a question about the follow-up for the last patient. Can you say something about
Yes, sure.
the follow-up for the second case?
Yeah, sorry, the follow-up. We didn't write the follow-up because, of course, the problem is related to time, but the allergy was completely cured. Of course, we are just showing cases where the remedy acted. Sometimes we are showing cases where we failed because we are human beings, so we are often giving a wrong remedy, trying then to correct and give the right one.
Donc, concernant le suivi du deuxième patient, je m'excuse, on n'a pas écrit le suivi par souci de temps. Mais dans ce cas-ci, les allergies ont été complètement guéries. Nous essayons de présenter, bien sûr, des cas où le remède a très bien marché. Des fois, nous présentons également des cas où nous avons échoué et nous montrons comment on prend notre erreur pour l'améliorer et la comprendre.
And related to the other question about posology, okay, we should need another seminar or perhaps two, but anyhow, just in a few seconds, I can tell you that we are using Korsakoff potencies more or less in the same way we are using LM potencies, so with continuous repetition.
Donc, concernant la question sur la répétition extraordinaire finalement par rapport à notre pratique du remède, dans le premier cas, oui, concernant la façon dont nous donnons le remède, on pourrait en consacrer 2 jours pour parler de ça. Mais juste en quelques secondes, je vous dis tout simplement que nous avons tendance à utiliser les dilutions corsacoviennes un peu à la façon des dilutions LM. On les répète très, très souvent.
So, as Florina told, I was taught by Fons Goekens in Belgium, and this is a research that we did together because little by little we started to use remedy in continued repetition. And so now it's more than 30 years that we have experience in giving the remedy like this and changing quantity. For us, it's very important to change quantity, to repeat frequently, and also with very high potencies.
Donc, comme Florina l'a mentionné au début, j'ai étudié avec le docteur Goekens en Belgique et c'est avec lui que nous sommes arrivés à cette idée ou cette façon de faire de la répétition continue ou de la répétition soutenue. Je fais ça depuis 30 ans maintenant. Je fais beaucoup d'attention au changement de la quantité, donc de la répétition et la répétition, de la fréquence de la répétition. Donc, c'est quelque chose que je fais depuis 30 ans.
So related to the question, if we have connection with Josh's map, we have connection with Bawisha and Sashindra because they are good friends and we love each other. But our method has not a connection with their map. It can look like because of the numbers, and it can be similar to Jan Scholten because of the numbers, but also there's no connection. So the number for us is just because we are trying to place all this job in a program. And so from this point of view, we need number as a mathematical language. Of course, there are some things that resemble, I mean, this is our way of thinking can be similar for certain point of view with Massimo Mangialavori way of thinking, with Jan Scholten, with Rajan Sankaran, with the Yoshis and so on. But this is just because all of us are using Teams, but then we have some similarities and some differences.
La question, est-ce qu'il y a une connexion avec la carte des Joshi? Nous sommes très amis avec Bavisha et Shashindra, bien sûr, et nous connaissons très bien leurs cartes. Mais non, notre système n'est pas tout à fait lié à leur système, tout comme voilà, il n'est pas vraiment lié non plus au système de Jan Scholten qui utilise le tableau périodique avec des chiffres. Et c'est peut-être là qu'il y a peut-être la confusion. Nous utilisons ces chiffres pour pouvoir les introduire par la suite dans le programme informatique et ainsi pouvoir trouver le remède. Bien sûr qu'il y a des similarités avec Massimo Mangialavori, avec Scholten, avec Sankaran et les Joshi. Et on travaille tous sur des thèmes, donc forcément, il y a des moments où c'est peut-être pareil, mais ce n'est pas identique. Il y a des différences également.
I think that what is peculiar on our system is this horizontal flow chart, because we can start from the group, we can start from the environment, we can start from the kingdom, and it's not necessary to have all the levels.
Je pense que ce qui est particulier à notre méthode, c'est cette pensée horizontale, parce que nous pouvons commencer ou démarrer, rentrer dans le cas, soit par la latitude, soit par le règne, et on n'est pas tenu à avoir tous les éléments pour comprendre les cas.
Because we have to think that, for example, all the fish has some topics related to the water environment. All the fish has some topic related to the animal kingdom. But then the attitude and the period can be very different. And the subgroup can be very different. So, for example, we spoke about the on the move, like the sharks or the tuna. But we can speak, for example, another subgroup is the tropical fish. So there is a big difference between, for example, Carcharinus leucas, that is a shark, and Amphiphyon percula, that is the clownfish. Both are in the group of fish, but on the move are quite different from tropical fish. So for this reason, we do believe that using sometimes the subgroups can be very useful.
I'll try to translate because there's quite a lot. Donc, alors, par exemple, dans la façon dont nous travaillons, les poissons, ils ont tous des caractéristiques de l'environnement aquatique. Ils ont tous des caractéristiques du règne animal. Mais dans l'attitude, dans la période, dans le sous-groupe, ils peuvent être très différents. Et on a vu un peu, on a parlé un peu en fait de ces poissons qu'on appelle tout le temps en mouvement, comme le requin ou le thon. Et on a un autre groupe très important en homéopathie ou dans les poissons qui sont les poissons tropicaux. Et dans ces poissons tropicaux, on va pouvoir remarquer que le poisson clown, il s'appelle Amphibius percula, il est très très différent du remède qui est le poisson du requin Carcharinus leucas.
So, for example, just to give you an idea,
Donc, pour vous donner une petite idée,
an example from the book.
un exemple de notre livre.
So this is the remedy we were speaking about.
Donc,
So
ce
this
sont-
is the page of the book of Carcharinus leucas, so the leucas shark.
euh, Donc, vous voyez ici la page du livre qui parle du requin, et donc c'est Carcharinus leucas.
So here on the left, you see the name, the common name, the rubrics, how many rubrics, for example, in general, we are writing rubrics from Synthesis Adonis. This remedy is not in Synthesis Adonis, but has 981 rubrics in the complete.
Donc, vous pouvez voir, on écrit donc le nom commun, le nom latin, le nom tel qu'il est dans l'homéopathie. Nous travaillons souvent avec le répertoire Synthesis Adonis, mais là, il n'a pas de rubrique pour ce remède, tandis que Complete Dynamics a 980 rubriques.
Then we have the group and the subgroup, and the proving, if there is a proving, who did the proving.
Donc, vous
Ouais.
voyez le groupe, le sous-groupe, et puis le proving. Qui a fait le proving et quand?
So then you have the number, so water animals predator series 6, fish on the move, and the name of the remedy. And on the right, there's the 8 essentials of the remedy.
Donc, vous avez par la suite tous les nombres donc, dont on a parlé, le ECAP et GPS, avec leurs caractéristiques. Et puis, à droite, vous avez les 8 notions essentielles que nous mettons dans tous les remèdes.
And in the same page, you have the 8 essentials of the group, so that is fish, and the subgroup that is on the move fish.
Donc, et puis en bas du tableau, nous avons les 8 notions essentielles qui appartiennent à ce groupe des poissons toujours en mouvement, où on retrouve le requin. Et puis à droite, vous avez les 8 notions essentielles des poissons en général.
So, and this we have for 100 remedies, as I told you. I don't know, we can have, for example, this is Genius Bay Wiki, and we have the same for the remedy birds, aquatic birds, so the 8 essentials for every remedy group and subgroup.
Donc, de la même façon, vous avez vu l'exemple de Sinus Beviki, donc avec les caractéristiques du remède, avec les 8 essentiels des oiseaux aquatiques et les 8 notions essentielles des oiseaux.
We are not denying the past, we are just adding something more.
Nous ne sommes pas en train de nier le passé de tout ce qui a été fait. Nous venons rajouter quelque chose de plus.
Merci infiniment, Viktoria et Roberto.